Hello, welcome to today's Lunch and Learn. My name is Brittany Rizzo and I'm the veterinarian here at the Akron Zoo. We figured today we'd just give you a quick little tour of the animal hospital and I'd be happy to answer any questions that you guys have. So, welcome to our treatment room. I'd say it's pretty average size. It is equipped with a lot of the same equipment that you guys might find at a normal small animal dog and cat clinic. So I'll just kind of walk you through real quick and point out some fun stuff. So, here is our pharmacy. So we have most of the drugs that we would need to handle most of the animals. One thing that I will say is that we have a fabulous relationship with Sandrun Pharmacy. It's a compounding pharmacy down the road. As you can imagine, when we're trying to treat anything from a tiny little frog all the way up to a grizzly bear, a lot of times the medications in their standard tablets, the way they come, is not going to quite cut it for the animals that we need. So we'll call them and say, hey, can we have this super big or super low concentration, and they like tutti frutti or liver flavor, can you put something together for us? And without fail, we have something usually that afternoon to give them. So that's why our pharmacy stays kind of small, because we do a lot of specialty compounding. The safe here is where we keep all of our controlled drugs. So a lot of those drugs are the ones that we use whenever we're going to have to immobilize an animal, put them under anesthesia to do an annual exam, something like that. So we keep that nice and safe and locked up. So moving on, we have a couple incubators here always set up. If a little bird on grounds gets injured, or we have a lot of bats here at the zoo, so if a bat gets injured, we have one ready to go at all times. This is our little microscope section. So we do a lot of blood work. We're going to do blood work on any sick animal and every animal in the collection every year to make sure that they stay nice and healthy. So one kind of little fun fact is that if you can picture your own human mammal blood cells, the red blood cells look like a donut, a red donut with nothing in the middle. We don't have a nucleus in the middle of our red blood cells, but birds and reptiles do. And because of the machines that we do to calculate our red blood cell counts, make sure that we're nice and healthy, they use that red blood cell, or the nucleus in the red blood cell, to count whether it's a red or a white blood cell. But machines can't do that with birds and reptiles. So my wonderful technicians, Sam and Kayla, have to manually look at the blood for every single bird and reptile that we have on zoo grounds. And we have a lot of birds, so they spend a lot of time doing that, and I appreciate them very much for that. Thank you, Sam and Kayla. Moving on, this is our autoclave machine. So this is what we do to sterilize all of our surgery equipment, make sure everything is nice and sterile so we can safely perform surgery without any risk of infection. This is a different blood analyzer where we can run chemistry panels, check your liver values, your kidney values, electrolytes, all of that stuff. Make sure you're nice and healthy that way. See, we got another scope. This is kind of our dirty poop section. So a lot of people don't like to think about poop, but you can learn a lot about poop, especially if they have any evidence of parasites or anything like that. So we will do fecal samples on all of our animals at the zoo at least 2, maybe 3 times a year to check for any evidence of parasites and treat if we see anything. So that's this section. We got lots of scales. We have a wet table so we can do dentals. So every time we have an animal under anesthesia for an annual exam, if they have any tartar or a tooth that looks like we need to deal with, we can do a dental right then and there. And we're very fortunate that we have this therapeutic laser. So that's a fun little tool that is very versatile. If you have a wound, if you do laser therapy, that can help with tissue healing. It can help with pain and inflammation. Sometimes birds get something called bumblefoot, where they get some inflammation and kind of stuff built up on the bottom of their feet. This can help treat that. If I'm doing a surgery, we can do laser right as we close the incision to help with post-op pain. It's a handy little tool. It's really fun to play with stuff.
So Isabella, who's 5, she would like to know, how do we handle giving medicine to the meat eaters, like coyotes or bears?
Oh, they're actually some of the easiest ones. So like you said, they love meat. So if I can get a medication either in tablet form or liquid, and I put it in a nice little meatball that looks a lot like what you put on your spaghetti, we can just toss that over and they'll eat it right up, and that's how they get their meds. So they're pretty easy to treat. Yeah.
So Brittany, nobody is asking this question, but I'm curious. How have we given the jaguars medicine in the past?
Well, cats can be finicky. So sometimes we can treat them, again, by putting it into meat. I believe Bella, one of the Jaguars that we had here until recently, she was a lover of cheese, I think specifically Velveeta cheese. So a lot of the times we'd have to put stuff into her Velveeta cheese, and she'd have her little cheese snack in the morning. Just like my kid, everyone loves cheese, so she'd eat that, and that's usually how we got it into her. And then there was another medication where we just squirt it right into her mouth, and she had a lot of good training, and she had a lot of trust in her keepers, so we were able to do that too.
Cool.
Yeah.
So Luke would like to know, what do you do with a worm if you find it in any animal poop?
Yes, so normally, hopefully, we've caught it before you actually see whole worms getting pooped out. You don't want to see that. But a lot of times what you will see are the eggs that the worms produce when you see the little eggs in the poop when you're looking under the microscope. So if we see that, luckily, based on how that egg looks under the microscope, you can figure out what type of a worm it is and figure out if it's a hookworm, a roundworm, a whipworm, something like that. And then we can use our medications and treat them, again, if it's putting it into a meatball or into a piece of cheese, and feed them and treat the worms and get them to go away. So, yeah. Cool. Okay, well, moving on. Since we're talking about giving exams to things, I imagine a lot of people, usually one of the questions I get is, how do you inject an animal to get them to go to sleep? Or how do you do an exam on a big, dangerous animal? So I thought I'd show you some fun stuff. So we have kind of 3 levels of what we do to be able to give an injection to an animal. The first one is called a pole syringe. So exactly like it sounds, it is a syringe on a pole. So if I even had a tiger, say I had a tiger or a lion, and they were trained to let me give them injections by hand, I still don't want to put my hand right up against the lion. I like my hands, I need them to work. I'd like to keep them the way they are. So I want to make sure that I can safely give that injection. So if I use something called a pole syringe, I can load up the drugs into the syringe, put the needle on the top, and then it becomes just like any other standard syringe, but my hand is now a convenient 3 or 6 feet away, which is wonderful. So basically how it works is, if you're going to give the injection, the animal is right here, I'm the animal, so you give them a poke, and then when you get into the hub, the pressure of you pushing it will inject the medication. So that's how we do that. So luckily, we do a lot of wonderful training with our animals, and most of the animals in our park are trained to allow us to voluntarily do that. So they're getting lots of yummy treats at the same time, and they will let us do that. If, however, we need to give an injection to an animal and they are too far away for me to do something like that, the next level up is something called a blow dart, which you don't hear about all that often, but it is something that is still used to this day. So it's basically just a metal pipe where you load the dart. And let me actually get the dart for you. They're pretty cool little inventions too. And based on the types of darts that we use, they can range anywhere from tiny little darts that have just a ½ ml of liquid in it, all the way up to 7 mils. It's a pretty big dart. So I would say typically an average for us is something in the 2.5 to 3 range. So what we would do is load the dart into the back where I have my little mouthpiece. Make sure I have lots of really good lung power. Maybe I do a couple practice shots to make sure that I can still do it. And we go, and then you blow really fast and really short, and you shoot that dart out at the animal, and then it hits the animal and injects the drugs. So this I can probably do pretty good with anywhere 5 feet to probably 20-foot range. That's when I would use something like a blow dart. So every once in a while though, if you have an animal that has a medical need, it might be sick and it needs an exam, or it just doesn't feel like participating in its vaccines that day, and but you need to get it in and you need to do a dart, but they're not going to come close enough for you to do it voluntarily, then we will use something called our dart gun. So, and I'd be lying if I didn't say this was one of the more fun parts of my job. So, it looks a lot scarier than it is, but here is our dart gun. So, It looks big and scary, however, it is quite literally powered by little CO2 cartridges, just like a paintball gun would be. Yeah, so you load that into a place right here. So I can say I can wing it around because there is no power behind it, so I promise you I won't shoot anything. You load the dart into the back, and then you have your power gauge. So you have this little thing right here that you can move back and forth to bring your power up. And the way you choose your power is by this handy little cheat sheet that we have here. So you can look at how far away you think you are from the animal and the size dart that you're using, and that will tell you how much power that you want to load up into the gun. And then you take aim. We have a sight, your standard sight. We have a flashlight, and we have a little laser sight, so that if you have to do something in the dark or where you need a little help because you're hiding behind something, you can use these tools to help make sure that you get a good shot. Take your shot, and there you go. So we do dart training at least 4 times a year. So this is also the tool that we would use if we ever had that unfortunate situation where a dangerous animal would get out. We do a lot of training, and we have a lot of safety procedures in place to make sure that that hopefully never happens, but you have to be prepared. So we are ready if that were to ever happen.
So Miranda, I don't know if you just caught that, but she did answer your question. They do practice with the darts.
Yep. So we have a nice little piece of land behind the zoo that is fairly wooded, so we can go back in there and we will practice at different distances from different heights with all different size darts and make sure that we can hit our target every time, so that everyone on the dart team feels very confident that if the need arose, we can hit our target. So, yeah.
So Noah and Parker would like to know, what would you do if a big animal ever tried to attack you?
Well, that is a good question. That depends on the situation. If it's an animal that would benefit from me staying still or running, I would probably do the thing that would give me the best chance. But if an animal got out, what we want to do is try to make sure that human safety comes first, and then we want to do everything we can to save the animals. So if we're in a situation where everyone can get to safety into buildings and we can safely dart that animal and bring them back into their habitat where they are safe and comfortable, then we will absolutely do that. Worst case scenario, if there is human life at risk, we do work closely with the Akron SWAT department. We do drills with them every year, so that if we needed to use that type of force, they could come in and help out as well.
Okay, and of course, for regular routine procedures, the staff are never in the same area with an animal that is not under anesthesia. There's
Correct.
always protective barriers.
Yes, so we do. That's why we do a lot of training. We work closely with all the animals, but through protective barriers so that the animals and the people stay safe. Once I've given their injections, unlike in TV, where it always seems to be so convenient, you give them a dart and then 30 seconds later they're on the floor. But that's not how it works in real life. It actually takes about probably 10 to 20 minutes for those drugs to take effect. Once they fall asleep, we'll kind of check them to make sure that they're really out and they're not too light. Once I feel confident that we can go in and safely work with the animal, I'll open up the doors. Usually if it's a big kind of dangerous cat like a lion, a tiger, something like that, we'll even duct tape their feet together just as an extra little safety precaution if they were to wake up a little prematurely. And then we'll do our procedure, and then we make sure that everybody and all the equipment is well out of there before we're ready to reverse them and wake them back up again. So, yeah.
So how many times have you had to use the dart gun?
Oh, well, I'm very fortunate again that our keepers and our behaviorists have a wonderful program, and we do a lot of training. So most of the time we can actually just do hand syringes, but I would say we probably use the dart gun for annual exams probably, I don't know, 10, 15 times a year. You think lower than that? 5 to 10 times a year? I don't know. I feel like we, sometimes, capybara. Between the dart gun and the blow dart, probably 5 to 10, maybe 15 times a year. Plus 4 times a year where we do our training in case anything ever happened. Again, we have a lot of safety protocols in place, so we have never had a dangerous animal escape here. So I have never actually had to put that training to the test, and we hope it stays that way, but we're ready if we need to.
So Lorelai wants to know, which animal hates the doctor the most, if any of them hate you?
Plenty of them hate me, unfortunately. I don't take it personally, but I would say at the moment we have a wonderful little old man golden lion tamarin named Rio. He's had a couple medical hiccups lately that have required a lot of more intensive treatment. So because of all the extra handling and all the extra medications that I've tried to give him, he's not my biggest fan right now. But actually 2 days ago when we went in to go deal with the stingray, he did let me give him some back scratches, so I think he's slowly forgiving me, which is good. Other than that, I'd say right now he's the one that doesn't like me the most. So, yeah.
So Everett wants to know, what animal are you the most scared of to work with, and what animal do you love to work with?
I love working with all of them. That's why it's such a difficult question. All of the animals are unique and different in their own ways, which makes it really fun and challenging to work with all the animals here at the zoo. I don't get to work with them that often, but I will say the few times that I do get to work with the octopus, they're octopus. They're such unique and crazy, smart animals that they are very fun to work with, and they definitely challenge you. So that's fun. For me, the thing that I'm most scared about, I wouldn't say scared, but I have a healthy respect for, is not a specific animal, but whenever I'm doing a big dangerous animal. So basically any animal that could easily kill a human if they wanted to. Lions, tigers, bears, all of that stuff. If I'm doing a procedure where they are under anesthesia, the scariest part for me is when you're waking them back up. So like we talked about, when I'm done with the procedure, I get all the equipment and I get all the people out of the way. But as I'll show you in the room, we usually have an endotracheal tube, a tube that goes into their trachea or your kind of breathing pipe, to make sure that we can keep control of the airway, keep the animal breathing. You don't want to pull that tube out until you know that that animal can breathe well on their own. So for humans and for dogs and cats, you usually kind of wait till they're waking up a little bit. They can swallow a bunch before you pull that out. But if I waited until a tiger was waking up to physically pull it out myself and get out of the area, that could be very dangerous to me. So for me, the scariest part is finding that fine line where everyone is out of the room and I'm holding onto a tube in the mouth of a tiger and I'm waiting for them to wake up just enough that I can pull the tube and they'll be okay, but not too late that they wake up and hurt me. So that's definitely the scariest part of a procedure, but yeah.
So has a big animal ever ran at you? Ainsley is asking.
Ever run at me?
Mm-hmm.
From the safety of an enclosure, yes. So one of my favorite things is, as you know, we have a new Pride of Africa area. Before we did that new renovation, the lions were actually right next to the hospital here. So we would pass by their exhibit every time I would come and go from the hospital. And one of the best things was Mandisa loved to play. So you would kind of sneak up on the glass and she would run up and jump at you and you'd run around the side and she'd chase you. So we would play a lot of chase every day when we came back and forth from the hospital. So yes, but only in a safe way.
Okay.
Cool. Well, let's take you into the treatment room / surgery room real quick. Show you some fun stuff we have in there. So this is our scope tower. So we have rigid and soft endoscopy, so we are able to look down into the stomach or up the back end of any animals in their GI tract to make sure everything is good there. We can do laparoscopic surgery. Penguins, I will use a little scope to look down into their trachea every time they're under anesthesia to look for any signs of respiratory disease. So this is a very sophisticated piece of equipment that can really get us a lot of good information. So I like that a lot. All your standard surgery monitoring equipment and all of that. One thing that's kind of fun to point out is that if you can ever picture being at a hospital, or if your dog or cat has ever been at the hospital, they'll put them under anesthesia using a face mask, right? So we have a lot of different sized animals and shaped animals here at the zoo, so we have to get a little creative sometimes. We have anything from your standard small, medium, large, face masks that you get for the dog and cat size. This is a perfect penguin size and shape, so this is our standard penguin mask. But you get a little creative. So some birds have very long beaks, right? But their nostril is still way up at the top of their beak. So if I want them to be able to breathe in the gas but not have their beak get in the way, we can use something like a casing for a syringe and modify it and turn it into a little face mask for birds, which is pretty cool. And then bleach bucket. So this one is kind of fun. This is a good size for our like our snow leopards, stuff like that, our smaller cats and our bigger hoof stock. Their face mask, or their face fits in here quite nice. The top we have fitted to go onto our large animal anesthesia machine, and it has a convenient handle, which is very, very nice when you're kind of moving things around. And finally, I'm told that we stole it with permission, but thanks to the great city of Akron, we have a traffic cone. So a traffic cone is actually the perfect size for your lion and your tiger for a face mask. Their muzzle, just this part of their face, fits into here perfectly. And the top automatically is already the perfect size for a large animal anesthesia. So it works great. So again, in the zoo, you get to be very creative. Thank you, City of Akron. I hope we did this with your permission. So moving on. So
really fast, Isabella would like to know how we keep the Arctic animals in the cold.
Oh, well, we always try to make sure that we can maintain every animal from wherever they are in the world. We keep that habitat for them so that they can stay comfortable. So if it is an animal that likes the cold, we make sure that if they're going to be inside, they have access to air conditioning. We can cool the rocks that they have in their habitat. We can provide them enrichment like ice and snow and rain and stuff like that helps cool things down. Lots of fans, lots of shade, cool pools and all of that. So if it's an animal that likes the cooler temperature, we do a lot of things on exhibit. Some you can see, some you can't really see, that can make it more comfortable for them in the cold temperatures.
So Danny wants to know if any of our animals can get the coronavirus. They have heard that cats and dogs can't, but can the animals here at the zoo catch it?
That is a very good question. I will say that there is a lot of research still going on to this day, just like in humans, to try to figure that out. But there is definitely the understanding that certain species could be susceptible more than others. So right now for our collection, the ones that we are taking extra precautions with are all of our primate species, because we know humans can get it, and humans and we are a primate, so the rest of the primates could be susceptible, especially the great apes. We want to make sure that we protect them. Ferrets, oddly enough, there is definitely some theories and some tests out there that show that maybe they can be susceptible to the disease. So we have one education ferret who is already actually immunosuppressed because he's under treatment for lymphoma that we're managing. He's getting to be an old man. So we want to keep him nice and safe, so we're taking extra precautions when we're handling with him. And then our bats, while we aren't worried about them necessarily getting sick, we do know that the main section of the genetic material of this COVID-19 virus did originate from bats. So it is theorized that our collection, the animals under our care, the bats, could potentially get that and become carriers of it, and we don't want that to happen either. So we are taking extra precautions with our bats to make sure they don't get it as well.
So what is the biggest animal that we have here at the Akron Zoo?
I believe right now that is Jackson, our grizzly bear. He's probably 500.
I believe he's around 600 pounds right now.
600 pounds. There you go. So he's our biggest. After the grizzly bears, it's probably going to be our lions. Specifically Donovan, I believe, one of our male lions. He's the biggest one. He is topped over 500 pounds, so he's a big boy. They're very fun to work with. So, yeah. Okay. Once we get out of the face masks, if we're going to keep them under anesthesia for a long time, the next thing that we're going to want to do is intubate them. So that's something where we take something called an endotracheal tube and we put it into the trachea, or that air pipe, so that we can make sure we can breathe for them or control their airway if they're under anesthesia. So that's another fun little thing to show. So for all you humans out there, I can show you that this is about an average size that you would use in an adult human, just for comparison. So we have to make sure that we can intubate all of the animals here at the zoo. So we will do anything from all the way down to 1 little millimeter. We can even go smaller and just use a catheter if we need to. And then the biggest one that we have goes all the way up to this one. So this would probably be big enough to intubate The biggest animals that we have here are something like a horse or a zebra, something like that, maybe a 2-year-old elephant. If you are in a situation, we don't have any elephants here at the Akron Zoo, but if you're in a situation where you do need to intubate an adult elephant, there's one veterinarian out in California that has some custom-made ones for adult elephants that are about this big around and as tall as me. So you call him and say, hey, can we borrow your materials and can you help us out? So, yeah.
So Lexi wants to know if there's a doctor available at the zoo at all times.
So, I am the main clinical doctor here at the zoo. So I, under normal circumstances, am working 5 days a week, and then I am on call the other 2 days a week. We do also have 2 wonderful relief veterinarians. Hello, Dr. Faust and Dr. Rob. So they do, for a couple weekends out of the month, will cover on call if I were to go on vacation or become sick. They would be on call for us as well. So if I am not here, I have 2 wonderful technicians. We usually work as teams. We stagger our days so that a technician is here on the days that I'm off. They can handle a lot of the stuff. They'll call me, and I'll come in if I need to for anything. So the animals always have the veterinary care that they need 7 days a week, 24 hours a day.
So do we sterilize any of our products before we use them on the animals?
Yep, absolutely. So as we talked about over there, we have our autoclave machine. And then actually back here, that machine that you can see through the window is our gas sterilizer. So if we need to sterilize any equipment that can't go in a normal autoclave because it would melt or something, we can run it through that machine as well. So in here, you can see all of our scope packs, our sterile surgery packs, our gowns, anything that we would need for surgery is wrapped up in pack material and sterilized and ready to go so that we have it clean, sterile, and ready to go if we ever need to do any surgical procedures.
So Danny had surgery and they gave her popsicles when she woke up. So do any of our animals ever get anything special after their surgeries?
Of course, yes. Knowing that I am usually the bad person to a lot of these animals, I want to make sure that I also spoil them just a little bit when they wake up because I want them to like me. So we kind of figure out what their favorite treat is, and when they wake up and when they can safely start eating food again, we will always offer some treats. Sometimes that's just some banana or craisins. A lot of animals love craisins. Some peanut butter, anything that they like, we'll usually offer a little bit. Another thing is that if I just did a procedure and maybe they're not very happy with me, I will try to go up and just make friends with them for a little bit after that. I'll go up and visit with no intentions in mind and just give them some of their favorite treats and say hello so that they can, start liking me again. So, grizzly bears, I think that's cherry pie filling. We have, whatever their favorite treat is, I'll go and give them a little bit of a snack. So, yeah. Moving on, I guess in here we have just kind of all of your, like any other hospital, your suture material, blades, anything that you would need for surgery. I don't know, lots of kind of random things. And under here again, more, as you can see, sterile equipment. So for the person that was asking about sterilized stuff, anything that we have in these packs as well has been sterilized and is ready to go in case we need to use it for surgery. So, fluids. We also want to make sure that animals stay comfortable under anesthesia, so we have something called a hot dog. So if they are under anesthesia, and sometimes you can get cold when you're under anesthesia, we want to make sure that they have a nice normal body temperature. So our table is warm, so we can turn on the warming aspect of the table and keep the table nice and warm. And we can also put a blanket on them that helps keep them warm as well.
So Anne is asking if we have any materials or PPE that are being donated to local hospitals.
Another wonderful question.
Yeah, so Anne, I would actually say stand by. We're actually going to be sharing more details about that later today.
Oh, okay. Then I will just keep that little tidbit for later, but yes. So more details coming soon, but absolutely. We appreciate all of our frontline healthcare workers, your paramedics, your doctors, your nurses, pharmacists, everybody that is doing everything that they can, risking their lives and their families to try to keep everyone safe and healthy. So thank you very much, and we are absolutely doing everything we can to support you guys. So thank you. Moving on. We also here have a little portable ultrasound machine. So as you can see, this table is probably not going to be big enough to support, you know, a male lion or a grizzly bear. So we do have another room elsewhere in the zoo where we can do surgeries on large animals if we need to. But for a lot of their exams, we're not going to take the time and the anesthesia to move them all the way to the hospital and back if we don't need a sterile, clean environment. So we like to keep everything nice and portable. Our anesthesia machine, our ultrasound machine, we try to keep everything nice and small and portable so that we can literally just pack it all up and bring it to the animal and do their exam in their habitat so that we can just make them fall asleep, do everything there, wake them up, and much quicker that way, much safer that way for everyone. So, yeah. Moving through. Again, so this is our little anesthesia cart. You know, we've had wonderful hospitals willing to, you know, even look into donating big, nice anesthesia machines, but we like to keep ours nice and small so that we can move it around the zoo as we need. And then, I think maybe we'll show you our X-ray area. So, this is our X-ray room. It's a little dark back here. Do you need to turn lights on here? So we have our standard X-ray table with our standard X-ray machine. We are very fortunate that we have digital X-rays. So, the plate for that is right here. So we can take X-rays on the animals, it'll pop up on the laptop, we can look at it, make any changes to it that we need to. We know right away if we need to take another X-ray, get a little better view. Much quicker, much safer, the animal's under anesthesia for less amount of time. We also have portable X-rays, so that kind of yellow banana colored box down there, that is our portable X-ray machine. So between that box and this plate, we can bring the X-ray, again, all around the zoo to the animals that need it. So we can quite literally just bring the whole hospital to the animal, which is great. Figured maybe we'd show you some fun X-rays.
Really fast before we do that, a couple questions.
Yes.
So, what is the hardest surgery you've ever had to do?
Oh, that's a good question. The hardest surgery I've ever had to do. I would say one of the trickiest surgeries I've ever done was on an animal called a Kahanzi spray toad. They, full grown, are literally maybe an inch long, and they are one of the few toads that gives birth to live young instead of eggs. So there was one, actually this happened twice, there were two toads that were struggling. They weren't doing so well, and they had a belly full of almost full-term babies, and we were concerned that if the mom died, the babies were going to die too. So I did an emergency C-section to save the babies on a full-grown frog that was that big, and saving babies that are probably 2-3 millimeters long. And between the two surgeries, I think we saved about 30 babies, which was fantastic. So great outcome, but a very tricky surgery to do, basically little microsurgery in an emergency situation.
So Manuel wants to know what your longest surgery has been.
The longest surgery, it's not one that I did myself, but the longest surgery that I participated in was actually a double hemilaminectomy spinal surgery on a lion. That was a 7-hour procedure, and a lot of work went into that. One of the nice things about being a zoo veterinarian is that you specialize in becoming kind of the ultimate generalist. You have to know a whole lot. You have to know a little bit about everything, but you know everything about nothing, if that makes sense. So we get to reach out to a lot of our local specialists that fortunately are very happy to come help us out when we need. So if we have something that needs a spinal surgery, I call a veterinary neurologist that would be willing to come out and help do the surgery. If I have a complicated eye surgery that I need, we have a wonderful relationship with our local veterinary ophthalmologist. Hi, Dr. Conway. Dentists, dermatologists. Any kind of specialty that exists in human medicine pretty much exists in veterinary medicine too, and we're very fortunate that we have good relationships with all the specialists in the area that are usually willing to come in and help out if it's something that really requires specialist care. So that is the longest procedure I've participated in, but I was more of a helper in that procedure than the main surgeon.
So that kind of answers this next question, if there's anything else you want to touch on. So how do you prepare to treat for so many different species?
Lots of reading. Yes, so luckily, at the end of the day, an animal is an animal is an animal. So, a liver is a liver, an eyeball is an eyeball. So there is a lot of information that you can just kind of extrapolate from one species to another. But at the same time, there are a lot of differences and a lot of little intricacies that matter to one animal and not to another, or how something is shaped or how it functions. So you do a lot of research. I learn something new every day. I come across something that I've never dealt with before every day. So you do a lot of research, you do a lot of extrapolation, you do a lot of research, like reaching out to co-workers, other zoo veterinarians, specialists, to try to get the information that you need, and you do the best you can. So, yeah.
So what is the worst wound that an animal has ever had that you had to treat?
Personally, it was not here at this zoo. It was actually when I was in an internship. But there was a dog that got attacked by a pack of other dogs, and then while it was trying to get away, it got hit by a car. So it came in with just flaps of skin and major trauma everywhere. We had to place chest tubes. We had to basically Frankenstein him back together. He had lots of pumps and suction tubes and everything sticking out of him. That was probably another 4 or 5 hour surgery just to do that. And he lived, and nice thing is animals usually heal up pretty well, so with good care. So that was probably the toughest, longest surgery. But again, it was successful, so it was a happy outcome.
So Danny wants to know if there are any animals that you cannot X-ray.
You guys ask a lot of good questions. So I would say yes and no. Some of the animals are so big that the technology that we have just cannot X-ray through everything if you're trying to do a whole body view. So you are not going to be able to X-ray through the entire abdomen or the entire thorax of an elephant. It's just not going to happen. However, you can X-ray parts of their body. So, if you have them trained, you can X-ray their trunk. They will hold up their feet, and you can X-ray their feet, stuff like that. So, but if you are dealing with something internal, something like an elephant is going to be very difficult to get an X-ray through. That's when you're using ultrasound, blood work, and kind of all of your other tools at your disposal to try to figure out what's going on. But X-ray for your really, really, really big animals, you might not be able to get all the way through.
So Asher wants to know how you keep the animals on the table for X-rays.
So sometimes they're under anesthesia, in which case we just keep them under anesthesia and they stay nice and still, and we can position them however we need to. Other times we have them trained where they can lay there. Other times we can kind of help them if there's something that we can hold, and they'll accept that. We can just kind of hold them in place and hold their little wings out and their feet. Other times we bribe them with yummy treats. So for example, our pygmy slow loris, when we wanted to see if she was pregnant, I didn't want to stress her out too much. I didn't want to put her under anesthesia. So you can actually turn this thing sideways and bring it down. So we kind of set it up so that the plate was on its side. That was turned on its side, and we had a little box for her to go into, and we smeared it with honey. And she would just stand there licking the honey, and then we were able to get the view that we need. So it depends on the animal.
Can you X-ray jellyfish or fish in general?
Yes, you can. So the nice thing is you will get a little bit of gray haziness, but you can X-ray through water. I can actually show you a couple of those X-rays.
Let's check it out.
Actually, I'll show you since you're asking that one right now. Let's see if I can find one underwater. So here we go. This is an axolotl. So an axolotl is actually a type of amphibian, but this was actually taken underwater. Oh. And we actually had a wet paper towel underneath the tub of water, which is why you see all of this weird stuff. But that animal is just sitting in water, comfortable, doing his thing, and then we were able to just take an X-ray from the top down, and you can still see everything that you need to. Sometimes, though, if you're going through a lot of water or your settings are a little off, it's not a perfect system. For example, this one, we had to adjust our settings a little bit. So it's a little bit of learn as you go. But yeah, we can definitely, absolutely do stuff underwater. One question that we often get is, do penguins have knees? Because, you know, you see them waddling all the time. It looks like they just have little stub feet hopping around on the rocks. So a question that we often get is whether penguins have knees. So we figured we'd show you that one, kind of answer that for everyone. And the answer is yes. There we go. So just like all the other animals, all the other birds, they have a femur that goes to a knee and goes down to the rest of the leg. So you can kind of see it a little better on this view. They're there, they're definitely in there, but they're just kind of hidden under a whole lot of other, you know, skin and organs and tissue and all of that. So it's kind of fun. Another one that's really fun to look at is, we'll show you Forrest. So Forrest is our education porcupine. Someone was asking if it's difficult to x-ray through some animals. And while we still can usually see what we want to, sometimes in some species of porcupines, it can be a little difficult to get through all of those quills. So as you can see, we were actually able to get a pretty good view here, but you can see all that extra skin and all those quills all over the place, which also just makes it tricky to move them around and not hurt yourself in the process. So that's Forrest. Another question that we get is, you know, bats. They have such weird anatomy. And yeah, their knees kind of go backward a little bit. So there's a nice view of a bat. This is Leon, another one of our education animals. And when you look at the side view, yeah, their legs kind of bend backwards and in the wrong direction compared to humans. So that's definitely interesting. And another thing you can do to compare, see how straight and beautiful that spine is? So we did both of our education bat exams that day. The other one's name is Sierra. And the reason she's in the education department is because she has a condition called scoliosis, which some of you may know about because it happens in humans as well. So she has a condition where her spine is curved. So she looks a little short, she looks a little curvy. And as you can see, that spine bumps up quite a bit along the back, and she has a shorter body because of that. So we make sure to take x-rays for her every year, make sure that it is progressing okay, make sure that she's not painful and that she's still living a nice, comfortable, healthy life despite this condition. So, you know, we have humans with special needs and differently abled people, and we have animals that are differently abled as well. So, yeah.
Right. Do you have any x-rays of an octopus?
I don't think we do right now. We might have some from a long while ago, but unfortunately this system that we got is only a couple years old. So we don't have all of our older x-rays available to pull up right now, but unfortunately, I'm sorry. I think the answer is no.
All right. All right, well, we have time for one more question,
Yeah.
and I'm going to go personal because both Levi and Danny, and you might have noticed Danny was asking a lot of questions. They want to be vets when they grow up.
Yay!
So do you have any advice for them?
Ooh, stick with it. Study your math and your science. Have fun with it. It is very hard to get into, but it is very rewarding. So if you want to do it, just stick with it. Keep studying. Get a lot of experience. Volunteer with any veterinarian that you can. Volunteer at the shelters. They always need help. Get experience. Have fun working with people, because you will always have to work with people, even if you say you only like animals. And just keep trying. Keep trying. You'll get there someday. So, okay. Yay. Well, thank you so much for taking the tour. I hope you had fun. I hope you learned something new today. Stay safe, everyone, and have a good day.